Hello, everyone. Today we are going to dive into the application of cognitive behavioral therapy to obsessive compulsive personality disorder and how OCPD impacts treatment outcomes for OCD when there is a comorbidity present. I am the presenter, Noor Asad, doctoral student, and my co authors are Christian Collin, doctoral student, Ethan Libby, doctoral student, and Dr. Sarah Bielek, Doctor of Psychology. This is a non-empirical poster through a collection of literature from 2010 to current, gathered through the Wright State Library database. To provide a visual overview of what we will be covering in these slides, we have the introduction, the results, a bit of discussion, and also how we can integrate this into clinical work. The last slide holds two QR codes, one of which leads to the full poster and the other which leads to the full page of references. Please scan at your leisure. Cognitive behavioral therapy is a well utilized and researched form of treatment for various psychological disorders. It is often deemed the frontline treatment. OCD and OCPD comorbidity have little research in the direction of treatment, but they are often individually treated with CBT. CBT can be effective in treating some comorbid cases of OCPD and resistant forms of OCD, challenging historical assumptions about personality disorder comorbidity. Current literature shows individuals with comorbid OCD and OCPD live with a greater severity of symptoms. CBT treatment can be effective when treating the comorbidity, but there can be a mixed effect on treatment. CBT treatment outcomes appear to indicate that the comorbidity should be accounted for during treatment. With CBT, thought restructuring shows to be valuable in relenting symptoms. CBT is more effective than exposure and response prevention because it uses cognitive processing as a main mechanism. Perfectionism can be used as a tool within the CBT realm, giving the client some of their autonomy back as they live with the disorders. CBT can be used for comorbid OCD and OCPD. In our clinical work, it allows the restructuring of irrational fears, it allows us to use perfectionism as an advantage, and it allows both the clinician and the client to approach with curiosity, compassion, and commitment to the treatment. Thank you for allowing us to present our findings. Once again, please scan the QR codes for the full poster and the full reference page. If there are any questions, please reach out to me. My email is listed.